All right, this is my musculoskeletal assessment. Everything that would be bilateral would be done bilaterally. So let's start. Okay, we're going to turn you around. I'm going to look at your cervical spine. It looks good. I don't see any misalignment. I'm going to palpate. Good. I don't feel any step-offs or any sort of misalignment. Good. I'm going to have you turn back towards me. I'm all the way towards me. I'm going to have you flex down. Good. Then extend back. Good. Okay. Then we're going to go to the ear laterally, other way, laterally. Good. And then I'm just going to have you look both ways. Any pain with that?
No.
No? Perfect. Okay. Now you can turn around and we're going to do your spinal process. So first I would inspect. I would look for any misalignment, which I do not see, or any deformities. Then I would palpate down the spine. Good. I don't feel any step-offs or any misalignment. And then I would palpate the paravertebral muscles, which I do not feel any muscle rigidity, any spasms, anything like that. Okay, we're going to flex forward. Try and touch your toes. Good. And this is a good spot. I could check for scoliosis. I don't see any misalignment, and shoulders are symmetrical. Okay, you can stand up. And we're going to extend backwards. Good. You shouldn't be able to extend more than like 30 degrees. Good. Okay. And then we're going to go left. Kind of lean laterally left. Then we're going to lean laterally right. Good. And then we are going to kind of twist at the waist. Good. And the other way. Good. Okay, perfect. All right, you can turn back towards me. You can sit down. And we are going to check your shoulders. So I would have you shrug. Good. And then I'm going to start by feeling at the medial end of your clavicle and kind of working my way out to the acromion process, and then to your greater tubercle of your humerus, checking all the muscles, making sure they all feel aligned, which they do. And then we are going to, for your shoulder, we're going to flex. Good. And extend down. Good. And then we're going to abduct. And then we're going to adduct across you. Good. And then we're going to internally rotate. So I'm going to have you scratch kind of your lower back. Good. And then I'm going to have you itch your neck. This is externally rotating. Good. Any pain with any of that? No. Good. Okay, now I'm going to look at your elbow. I'm going to inspect it first. I would do this bilaterally. And then I'm going to palpate the olecranon process, which is the tip of your elbow. And then I would palpate the lateral and medial epicondyles. Which good, they feel good. All right, now we're going to do range of motion with your elbow. So I'm gonna have you flex, good, and I'm gonna have you extend against me, good. And then we're gonna do pronation, which is like this, and then supination, up, good. Okay, good, those all look good. And then we're gonna move on to your wrist. So I would inspect your wrist first. It looks good. I don't see any sort of misalignment, no redness, lesions. Then I would palpate the ulna and radial heads all the way down to your fingers. Good. They feel good. Okay, and now we're going to do range of motion at the wrist. So I'm going to have you flex up, extend down. Good. And then we're going to do ulnar and radial deviation. Good. And then we're going to have you flex the fingers, just the fingers, and then extend the fingers. Good. We're going to abduct the fingers, and then we're going to adduct the fingers. Good. That all looks good. I'm going to have you test my hand strength bilaterally. So I'm going to squeeze as hard as you can. Good. 5 out of 5 bilaterally. And then I'm going to do the Fallon test. So I would have you, I would have you go like this. And then press your wrists as hard as you can together. We would do that for 1 minute for the sake of time. We're not going to do that. But if you feel any numbness or tingling in your hands, that would be a sign of carpal tunnel. And then the Tinel test, I would strike the median nerve. And if that would cause any numbness or tingling, that could be a sign of carpal tunnel. The leg and feet exam, I already did complete on the peripheral vascular assessment, so I'm not going to check for color, cap refill, or anything like that. Next, we're going to do the hips, so you can lay down. So I would inspect for symmetry first, which they look symmetrical. Then I would palpate the hip joint. He is a little ticklish. And then I would have you turn on your side, and I would palpate all the way back to the ischial tuberosity. Good. Okay, you can come back. Now we're going to do some range of motion. So I'm going to have you straight leg flex at the hip. Good. Good. This could be a test to test for sciatic nerve pain too, if that would have felt any pain at less than 45 degrees. And then we are going to abduct. So I'm going to move you out. Good. We're going to adduct, move you across. Good. We could do extension. That would be if he was standing up and putting his leg back behind him. And then we are going to externally rotate. So for externally, I'm going to have you bend your knee. Put this right there, and then you can push down as far as you can. That's externally rotating. Good. And then for internal, I'm going to have you just go like this and kind of bend it in that way without moving. Good. Okay. Looks good. Any pain with any of those movements? No. Okay, perfect. Then we're going to do the knee. I would inspect the knee, then I would palpate around the patella. I would do lateral and medial femur condyles and the tibia and fibula, and then I would push back to the patella, or the posterior side too. Good. And then I'm going to flex and extend at the knee, so I'm going to have you sit up again, Alex. Sorry. So I'm going to have you push your knee out towards me against resistance. Good. And then pull back. Good. Good. 5 out of 5 on that. Okay. And then you can lay back down again. I'm sorry. We're going to do a couple tests. So first I would do the bulge sign. This test for any effusion of the knee. So I would push down on the medial side of the knee. And then I would push down on the lateral side. And if there was fluid in there, it would bulge out back to the medial side. For ballottement, I'm just going to push on the patella. I would notice any clicking noise or feel any clicking, and I don't because he does not have an effusion. But if I did, that's where it would be. And then we're going to do the McMurray's. So I'm going to flex your knee. Then I'm going to hold it. Okay. And then we are going to test the medial meniscus. So I'm going to pull out. Let me do it. Good. And then we would come back this way, and we're going to test the lateral. Good. And if there's any pain or any movement, we would worry about meniscal tears. And then we're going to do the anterior and posterior drawer. So I'm going to bend your knee again. I'm going to sit on your foot. I'm going to put my hands behind your knee, and I would pull out. That's testing for the ACL. And then I would push back, looking for any movement that would indicate a PCL tear. Good. Okay. I don't suspect either. Okay, now we're going to look at the ankle and the foot. So I would inspect. It looks good. They're symmetrical. I don't notice any edema. I would palpate the lateral and medial sides all the way down to the metatarsals and your toes. And then we are going to flex and extend. So we're going to dorsiflex up, like your nose to your toes, or toes to your nose, and then you're going to push down on my hand. Good. That's plantar flexion. Good. Okay, and then you're going to flex your toes, extend your toes. Good. And then we're going to do inversion, which we're going to just kind of push it in. And then we're going to do eversion, where we push it out. Looks good. And then we are going to rotate. So can you just rotate your ankle? Good. Good. Okay. Looks good. And that is the assessment.